a girl was helping him.
Okay.
At a point, he now decided to ask the girl out, "Can you be my girlfriend?" And now the girl now asked him a question.
Okay.
Are you telling me that blind or visually impaired person also
Yeah.
dates or
You have feelings.
Yes.
If you have a good mental health, definitely you would be having a good self-image. That means
Okay.
your self-esteem will be high.
Yeah.
Okay? And if you're having a bad mental state, right, you would be having a bad self-image, which means your self-esteem will be low.
Welcome to my world, my reality on Liberators Network, where minds are free, where voices are amplified, where we break boundaries and inspire change. I am Chizoba Orji, your favorite blind presenter. Today, we'll be looking at disability and mental health. Many persons with disability are smiling, but in their hearts, it is full of pain. Today, we have a wonderful therapist in our midst. His name is Victor Paul. Victor, how are you today?
I'm fine, Mr. Chizoba. It's a privilege to have me here. Yeah.
You're welcome to our studio today.
Thank you.
Today, we are looking at persons with disability and mental health. I know as a therapist, you are conversant with such situations most of the time.
Yes, quite obvious.
Yeah, before we start, we'd like to know what is mental health itself? When you talk about mental health, what are we talking about?
Okay, so according to World Health Organization, when you refer to mental health, you're referring to a state of your mental capacity. That
Okay.
is, you're referring to a state of your mind,
Okay.
how your brain perceive information, process this information, and respond to this information. Now, when your brain perceive information, process information, and respond to this information in a positive manner, then you are regarded to be having a healthy mental state.
A healthy mental state.
Yes.
Okay.
But when your perception of informations, processing and then responding to these informations are on the flip side, the negative side,
Yeah.
definitely it is a bad state of mental health. So that's it.
Okay. From what you said, you tried to tell us that mental health have the positive and the negative side of it.
Yes.
And today we are trying to look at persons with disability and their mental health.
Yes.
Most of the time, being a person with disability truly is not something to be happy about, but it's something we are trying to manage.
Yes.
Now, do you think a person with disability is having a good mental health or a negative mental health? Do you think most of them are having a good mental health or a negative mental health?
Okay, so just like I earlier said, that you could have a good mental health or a negative bad mental health, right?
Okay.
Okay, now having that being said, we should also understand that there is a link between having a good mental health and a good self-image
Okay.
of oneself. So if you have a good mental health, definitely you would be having a good self-image. That means
Okay.
your self-esteem will be high.
Yeah.
Okay? And if you're having a bad mental state, right, you would be having a bad self-image, which means your self-esteem will be low. Having said that, there are factors that contribute to an individual, be it individuals who are impaired, visually impaired, or have some other form of conditions, physical conditions,
Yeah.
or even neurological conditions. There are factors that contribute to them being negatively impacted in their health. That means they will have low self-esteem,
Okay.
right?
Yeah.
And some of these things are inclusion. So when individuals begin to perceive that they are not included, and how they begin to perceive this is by experiencing physical barriers and isolation.
Okay.
Yes. So, for example, in a school that was structured for those that are not visually impaired, right? There's a way the school will run. There's this way the school setting has been made to suit those people who have vision, who have sight, right?
Yeah.
Now, if a child comes in and there is no accommodation of that child's condition, definitely that child will find it difficult navigating through the physical structure of that school, thereby making the child feel unheard, unseen, and start feeling isolated. So there are many factors that contribute to fostering a good self-image. And yes, individuals who are visually impaired or have other physical conditions, they definitely face this challenge. And it is so unfortunate that in the world and society we find ourselves today, they face the pressure more than others. So, in a nutshell, the pressure, it's not just synonymous to individuals who have one physical condition or another. Those who don't have physical conditions also face the pressure, but it is more on those who have physical conditions, such as they have visual impairment and the likes. So yes, they face this pressure. That's it.
Okay. I totally concur with you with what you said, because as a visual impaired person that I am, when I became visually impaired, nearly one of the things that I suffered was a kind of withdrawal. I started having low esteem.
Okay.
So at a point, I disappeared from the society. You won't see me online. I am not on Facebook. Physically, you won't even see me, because I'm a kind of hiding. I don't know how people perceive it, that Chizoba is no longer seen again. So this is a kind of negative mental health.
Yes.
Do you understand?
Yeah.
And it really affected me.
Yeah.
And I know that one of the mental health,
Yeah.
negative mental health people suffer is a trauma.
Yes.
But I want you to also tell us more negative mental health persons with disability may pass through.
Okay.
Yeah, I would like you to emphasize on those negative mental health persons with disability are passing through. Yeah.
Okay. So if we are looking at presentation of mental health conditions in individuals who are impaired, that have physical conditions like visual impairment and the likes, just like you have stated, and I must say that must be a very tough time for you at that period, and not just you, it is synonymous to
Every other
yes,
persons with disability.
with the disabilities, be it visual impairment or other forms of physical disability. One of the presentation is depression. We have trauma. We have low self-esteem.
Okay.
Yes, and all these things start with the society not being able to acknowledge these individuals as individuals.
Okay.
Now, this is what it means. The society favors those who they term are whole. The society have seen these ones as being whole. They are okay. Okay, now those ones get a form of favoritism.
Okay.
I'll cite you an example. So we are able to drive down this and people are able to understand. How many visually impaired president do we have in the world?
None.
How many visually impaired governors, mayors do we have in the world? I don't know of any.
No.
How many visually impaired senators? Let's even streamline it to Nigeria and Africa. How many visually impaired individuals hold sensitive political posts? You will see that they would begin to relegate them to the background. They will even, overshadow their voices at the grassroots level. They will see them that, no, you are the one that is supposed to be cleaning the chairs, you are the one that is supposed to be begging, you are the one that, they leave them at the mercy of situations. Instead of the society to put these individuals at the forefront of care, they rather relegate them. So all of these actions trickling in makes the individual to become isolated.
Yeah.
Now, I will cite you a practical example of how this feels. If you go to the market is known to be a noisy place, especially in Africa and most parts of the world. You go to the market, it's a noisy place. If you go to the market and then you are shouting on top of your voice, will your singular voice overshadow that of the noise in the market? No. So this is a typical analogy of what the physically impaired individuals go through. It is them against the world, which is not supposed to be so. So because they feel unheard and they are actually unheard, they start feeling unseen, they begin to feel isolated. The brain begins to let them know that this is reality. Nobody's going to hear you. Nobody's going to come for you. So that once large circle of friends that they used to have begin to shrink, be it friends or even family. It begins to shrink. It begins to shrink almost to the point whereby they are left alone. So one of the presentation is isolation. They suffer isolation, great isolation. Okay. Another thing they suffer is depression.
Depression.
Yes. When isolation has persisted for a number of time and that individual have a very, very low self-esteem, depression will set in.
Okay.
And from there, you just never can tell. Death might just be the end stuff.
While you are talking, I was thinking of so many things because, this mental health we are talking about today, I want to look at the causes. And from what you are saying, it looks as if society is one of the main cause of this mental health to negative mental health to person with disability.
Yes.
Because it is the way the society accepts persons with disability will even make them to feel better.
True.
But the way the society is treating them is making them not to feel good. I will cite some cases.
Okay.
Let me come to the area of a relationship or marriage.
Yes.
Okay, when a visually impaired person want to marry a girl that is sighted, a girl who is not living with any disability, the family of that person will begin to ask the girl, so in this whole world, you didn't see any other person but this person with the visual impairment. And when you as a person with visual impairment begin to hear such,
remarks.
Remarks about you.
Yes.
this will definitely lead you to depression.
Definitely.
Yes, it will lead you to depression because you now feel that the society somehow is rejecting
Yes.
you. Yes.
Yes.
In this our podcast some time ago, I hosted a visual impaired person who
Okay.
told us here that he was, a girl was helping him.
Okay.
At a point, he now decided to ask the girl out, "Can you be my girlfriend?" And now the girl now asked him a question.
Okay.
Are you telling me that blind or visually impaired person also
Yeah.
dates or
You have feelings.
Yes, it looks somehow, and my guests told me that this thing disturbed him for a while.
It shattered his
Yes,
morale.
because he started feeling as if he's not
Enough.
a human being. Maybe he's an alien from another planet coming to live with us in this earth. Do you understand?
Yes.
So these are the things society do that make persons with disability to feel depressed.
Oh.
This one is in the area of
Marriage
yes,
and relationship.
yes, in
Yes.
the area of marriage or relationship.
Yes.
Let me talk about public transport.
Okay.
As a visually impaired person,
Yes.
sometimes if I'm standing on the road, maybe the
Yes.
bus will stop. Where are you going? Oh, yeah, no. I beg, I will not carry you because nobody is there to help you.
Oh, okay.
And another day, a guy on wheelchair was telling me that most of the time he don't move around because all these buses, they will not carry him because
Okay.
they feel like, which time will I have to carry your wheelchair and go and
Yeah.
put it on the
back or the
and
boot
then now
and stuff.
put you,
Yeah.
all these things. And this thing is causing a heavy trauma or depression
Yeah.
to that
Individual.
Yes. As a therapist,
Yes.
I don't know how you see all these things and what you have to tell persons with disability that are listening or watching us. What do you have to tell them when they begin to feel this way? What do you have to tell them?
Okay. It's such an unfortunate incident and occurrence, and my heart sincerely goes out to you and every other individuals living with one physical condition or another. And before I proceed, I would like to reiterate this, that there are two types of conditions. We have the physical condition and we have the mental condition.
Okay.
And that mental condition, as a therapist, we call it neurological condition, where you have the autism, ADHD, and the likes.
Yeah.
Yes. So there are individuals who the society see as okay, in quotes, that are not okay. In quotes, they are not okay. Right? They are having their own form of
A disability.
disability.
It's
Yeah.
neurological.
Is internal.
Yeah.
You can't see it.
Yes.
But you can notice it if you pay close attention, or if a professional like myself, interact with the person.
Yeah.
Definitely, I would be able to decode. Okay. So, and there is the physical condition, which has to do with visual impairment and every other form that we all know. Okay. Now, that being said, citing marital, conjugal bliss. Visually impaired individuals are not exempted from enjoying the benefits of companionship. They are not exempted. Visually impaired individuals have the same right legally to marry. So, saying that because they are visually impaired or a person has one physical condition, that the person will not engage in marriage is fallacy, is wrong. And it all boils down to sensitization. Most individuals, once they see another person living with disability, definitely they have written the person off,
Yeah.
which is not fair. Now, I'll cite you an example. There's this popular actor called Nkubi.
It could be, yeah.
Yeah, and everyone know his condition, right?
Yeah.
It's genetic and all of that. And he got married to a particular lady who doesn't have that physiological
Disability.
yes. So what happened? People started bantering the young lady, the wife, started bantering her and bantering.
Why will
and
you accept
yes,
such
why
a
will you
man?
accept here? You give birth to this and all of that. This and many more are examples of people who are suffering from stigmatization.
Yeah.
And it is bad. And to clear this stigmatization, we need to do more in sensitization. So the antidote of stigmatization is sensitization. So when you want to take away stigmatization, you need to sensitize the people. You need to educate them. So one thing that the visually impaired community and other impaired, individuals, communities can do is to have advocates. Have advocates in government places that will speak for you. Have advocates in religious gatherings that will speak for you. In doing so, the voices of these communities will be heard in critical places, and definitely laws and rules will be passed. So, when it comes to marriage, no one should deprive a visually impaired individual of companionship. They have blood and they have hormones, except there is a special condition which is not in any way linked with visual impairment. Visual impairment is one thing on its own. Having a condition which affects possibly this person's sex life and the like is another thing on its own. There are two parallel lines. They do not connect. Okay? So it is essential that people understand this, that to be visually impaired does not mean that your brain is blind.
Yeah.
A person might have eyes but lack vision.
Yeah.
A person might not have eyes but have vision.
Yeah.
So vision is not synonymous to your physical eyes.
Yeah.
Vision is a thing of the mind. It's your mental capacity.
Yeah, Helen Keller said something about what you just said. She said, being sighted is not the issue here. Rather, being sighted without a vision, that is where the problem is.
Problem is.
Yes, that's what the popular Helen Keller said.
Yes.
Yeah, sometimes some people are not born living with a disability.
Yes.
Sometimes some people move. It's not planned.
Yeah.
Sometimes it may be accidents.
Yes.
Sometimes it might be health issues may lead some people into becoming disabled. So what I notice is that when people are transcending from being normal
Yeah.
to
Not.
living with a disability,
Yes.
they suffer trauma.
Yeah.
Just
sure.
imagine somebody who is up to 20 years, 25 years, maybe a young boy that normally play football. All of a sudden, the boy had an accident. It won't be an easy one for him. When I I attended a program of persons with disability like 2-3 years ago. So I met a guy, David. So David was telling me he used to be a professional photographer. So
Okay.
one of the days he was going back from work. So he was sitting at the back of the bus and they had an accident. And that was it. He became blind because the screen of
Yeah.
the thing.
The glasses shattered into his
Yeah,
eyes.
yes, and that was how he became blind.
He lost sight.
Yes. So, for David,
Yes.
moving from being a professional photographer
Yes.
and now becoming visually impaired, this is a very, as in, a great trauma for him.
Yeah.
A very great trauma for him. And every day, people are moving from becoming normal to becoming disabled. I don't know, as a therapist, when one newly become disabled and they are passing through this trauma, what do you have to tell somebody like that? Assuming the person is watching us, what do you have to tell somebody like that?
When life gives you lemon, turn your lemons
To lemonade.
to lemonade. When life throws marbles and pebbles at you, don't complain. Use them as a stepping stone to the next level. When life throws you block, use them to lay foundation for your building. Everyone faces challenge in unique ways. For the child in primary school, the challenge could be understanding arithmetic. Another child in primary school, the challenge could be understanding English, comprehension, composition. A child in university, the could be analytical chemistry, it could be quantum physics, it could be quantum chemistry or the likes. So, in essence, everyone have a challenge. It's just that this challenge is individualized. In this case, where an individual lost their sight or have lost possibly an arm. So the person arm or maybe a feet has been amputated. So the person is moving from one condition to another. Definitely that time is very, very crucial. And what the person needs is support, moral support, and financial support. But above financial support, moral support is very, very important. But at the same time, I would like to cite an analogy. When you look into the mirror, who do you see? Do you see me? Mr. Chizoba, I'm asking you.
I am blind, I can't see.
That's good. So, but if you look into the mirror, right? If you, as you are,
Yeah.
if you face the mirror, I'm not going to see me. I'll see you,
Yeah,
right? It
yeah.
is you that would appear in the mirror.
Okay.
Good. So, in essence, what I'm trying to say is, in situations like this, external help will come, but the one you give to yourself is what you need the most.
The encouragement you give to
Yes.
yourself.
Was it Paul, the apostle? He said, I encourage you, right?
Yeah.
Yeah. Was it Paul or David? He said, it was David when he was writing. He said, I encourage myself in the Lord. So, in your tribulation, in your challenge, you need to learn how to encourage yourself. Now, there is a word that is called astute. And astute means individuals that are able to quickly turn negative situations into a positive one. So, to every gloom, to every darkness, you find a silver lining. So, even in that visual impairment, even in that amputation, there is something positive there. Yes, we have individuals who are visually impaired and they are great speakers, they are great writers, they are good at whatever their hand have found to do. So don't just sit there and suck. Don't just sit there and become the dumping ground of the society. Don't allow the society turn you into a garbage. No, You need to recycle the whole thing. You need to put yourself out there. You need to set yourself to work. And one way to do this, before I go into that, is why these individuals are experiencing this. It is normal, right? Because no change is comfortable. This is a law of life.
Okay.
I'm coming.
Okay.
Having said that, one thing they need to do is get a skill. A dormant mind is a dead mind. And once a mind is dormant, definitely it becomes a dumping ground for the society. But if that person puts himself or herself out there to learn a skill, either a soft skill, any skill that's quite productive, you would see that over time there will be a mind shift from, oh, I used to be like this and like that. So, and lastly on that, there is this saying that when the preferable is not available, the available becomes
desirable.
the preferable.
Yeah.
So if you had wanted to be, pick up a career where your sight, I'm using sight for this context now.
Okay, let's just say that David I told you,
Yes.
he was a photographer,
Okay.
but he now ended up as an audio editor now.
Now you can see that. So he wanted to be a photographer. So he needed sight to be a photographer. That is his preferable. But because he lost his sight, he became an audio editor. That one is the available. So the available became the preferable. I can tell you that now he will be living, I don't know him personally, but I can say from your story that he will be living a fulfilled life. He will be happy, other than when he was just dormant and they're sucking. So that's it.
You know, the aim of this program is to educate both persons with disability and the society at large.
Yes.
As we are talking to persons with disability, we will use this opportunity to talk to the society at large in any way they are contributing towards the mental health, negative part of the mental health of persons with disability, for them to also retrace their steps. Let me give you another example.
Okay.
Do you know that once you're a person with disability, society begins to, even if you are 40 years, society begins to see you as a child. Society begins to look at you as if you don't have anything to contribute.
Beauty, yeah.
Society begins to look at you as if you can't think. They have to think for you.
Yeah.
Yes. You can't make a choice. It's the one they make, is the one that you will take. Especially persons with visual impairment, they will now ask you, can you see? Are you getting me? And, sometimes they don't know that all these things are affecting persons with visual impairment within their heart. Most of the time, okay, personally, I might be smiling, but most of the time when I'm in my private time or quiet time, or when I'm alone, I'll be crying because of what the society must have said, or what the society must have, the character they have displayed. And at that time, do you know what will come to your mind? If not because of this, this will not be happening. Do you understand?
Yes.
And this is when you begin to regret, or begin to cry.
Start reminiscing on past events, how you used to see, and
is
now
it not
you
because
don't
of
see?
this?
Yes.
Do you understand? Maybe you ask somebody to do something for you, the person did not do that
it,
thing,
yeah.
and on a normal day, this is something you do, and
effortlessly.
Yes. And all these things are things that will affect persons with disability. I'm speaking for them because I know it's not just about me. It's about all of us.
The community.
That are in that community. Because when these things are happening, maybe the caregiver or whoever that is around you may not understand what you are passing through. And sometimes persons with disability always live in mood swing because of because of this mental health um, issue. So, as our therapists here, I would like you to talk to the public, to the society, on the dangers these attitudes, these attitudes they normally exhibit to persons with disability. That it have a great negative effect to the community of persons with disability.
Okay, so we have persons with disability are more sensitive, emotionally sensitive than individuals who are not with disabilities. And it is important that from our words and our mode of conduct, we show fairness and be kind. Kindness is an attribute of a sane person. So anyone who is not kind is not sane.
Okay.
Yes. So my advice to the general public is to be kind to everybody, not just in persons with disabilities, not just individuals with disabilities. Be kind to everybody. Do to others what you would wish they do to you. Do to others what you would wish they do to you. So what you cannot take, please do not give.
Okay.
So, in a nutshell, if that is done, definitely everyone will have an equal playing ground. Everyone will have equal support. Yes.
Before we go into therapy to support persons with disability who are going through mental health challenges
Yes.
because of their condition,
Yes.
is there any medication um, for them? Do they have medication apart from therapy?
Persons with disabilities, medication in the form of correcting the disability or
Medication like is there any drug they normally take? Maybe when they are depressed, when they are traumatized, are they placed on drugs or something like that?
okay, so if you're saying medications to support their emotions, their feelings, right?
Yeah.
Before a medication can be prescribed, it must have shown threat to the existence of that person. So, as a therapist, I'm not in the right place to, and this, yes, to say this is what you will take, this is what we take. There are medical practitioners that it is their responsibility. But to the question, yes, there are medications. But before a person will be put on medication, the condition must have been one that is critical or it is life-threatening.
Okay.
Yes, so
Is
that's
there
it.
any is it, should I call it treatment or therapy for these mental health
Health.
challenge? Yes.
Yeah, sure. There are several you know pathways to therapy. Yeah, there are therapies to mental health. Definitely, there are therapies to it. Um, Personally, I am a behavioral support therapist.
Okay.
Yeah, amongst other form of therapy that I am licensed to perform, right?
Okay.
And one of the things we pay attention to is pattern.
Pattern.
Yes, we pay attention to pattern,
Okay.
and yeah, so we do what we call the ABC, right? It's called antecedent, behavior, and consequence. So we look at it.
Antecedent, behavior, and
Behavior, yes.
consequence. Okay.
So we look at it. Antecedent, what action prompted this behavior, and what is the consequence?
Okay, you are taking the ABC one.
Yes.
Okay.
So what consequence will precede this behavior? So when we look at it, we analyze it, we will be able to come up with individualized therapeutic frameworks that will suit that person. So if it is words that triggers the person, that is an antecedent, and the person then behaves very violent, that's the behavior. As a result of behaving violent, possibly relationship are broken, even physical objects are broken, that's the consequence. So therefore, what do? We will just find a way to regulate the environment of that person to make sure that words like that, triggers like that, are taken out of the context so the person will have a stable life. So that's it. Just like, let me cite you a typical example. You have a clean water,
Yeah.
and then you add mud.
Okay.
When you add mud, is it still clean water?
No.
No. So before you add mud, it was clean water.
Yeah.
Good. So to get your clean water back, what do? You sieve,
Yes.
right? And then you boil and you sieve
Yes.
again. Yeah. So
do
that's
some purification
yes, you do
process.
some purification process. So that's it. So yes, therapy is one professional pathway I usually advise individuals to pursue, especially when you're having mental challenge. You're having challenge, could be from marriage, could be from work, it could be from being physically having some form of disabilities or the likes. Make sure you get the service of a professional therapist. It is very important because in this part of the world we do not really pay much attention to therapeutic support, and it's very, very bad. When you undergo divorce, how many individuals, how many once married divorced individuals go for therapy after or during the divorce process? Let's look at the statistics, right?
Yeah.
Now, then individuals who are persons living with disabilities, they need to go for therapy.
Yeah.
How many individuals who once used to see and then stopped seeing went for therapy? So you can see that you are leaving these individuals to do trial and error on their own. And I can tell you for free that you have individuals who are persons living with disabilities who abuse substances.
Yeah.
And they abuse these substances not because they want to abuse substance, but that substance has become their safe haven. But instead of that substance to alleviate their trauma and their distress, it is just giving them a short time relief, and then the distress is even either multiplied or even quantified.
So one of the ways of them escaping their trauma is by abusing substance.
Yes, that's some individuals.
Some individual.
Yes.
Yes, I totally agree with you because not most, but some persons with disability, they abuse substance. And when I gradually started trying to dig out what must be the cause of this thing, I noticed that they are trying to escape, because that when we are talking about low esteem and all these things, because they are no longer proud of themselves.
Yes.
They cannot fit in with the society again. So the only thing they can do is to take the substance, which will give them, or should I say,
temporary joy, temporary relief.
Yes. So that particular traumatic condition they seem themselves have, lead them into taking those
abusing those substances.
Yes.
Yeah.
And instead of curing them of they're even going into more
depression.
Yes, depression and even more health issues. Yes,
I agree.
Okay, Mr. Victor. Today you have been a very educating time with you, and I'm happy to have you in our studio today.
Thank you very much.
The major aim of this mental health with concerning persons with disability is for us to look at it and talk about it. And we are not ending this conversation here. We are bringing you back because we have more and more to talk about the mental health of persons with a disability. One thing I have to tell the society is that they contribute a greater percentage to the mental health of persons with disability. And for them not to continue that way, they have to encourage persons with disability. They have to change the way they talk to persons with disability, their attitudes towards persons with disability, and also giving them opportunity that they really, really deserve. All these things help in giving them a positive mental attitude. Mr. Victor, do you have any last word to tell our viewers on mental health and persons with disability?
Stay out of drugs, seek professional support, and yeah, pray always. That's it.
Okay, that's good. And I will not end this without saying, guide your heart with all diligence, for out of it flows the issues of life. I still remain your favorite blind presenter, Chizoba Orji. Thank you and see you on the next episode.